Republicans want to eliminate the health insurance subsidy for 112,000 residents of California. Hello, I am Kevin Knaus with InsureMeKevin.com, an independent health insurance agent, and also a Covered California certified health insurance agent. And as of May 2025, moving through the House of Representatives is the budget reconciliation bill shepherded by Speaker Mike Johnson. And it is a massive bill, and it's hard to keep track of everything that is in it, but there are some severe changes to the Affordable Care Act and who is eligible for the subsidies and how you get them. Covered California did an analysis of the language within the bill, and they also looked at the Congressional Budget Office data as to how it would impact people that are receiving the Affordable Care Act health insurance subsidies. And they put out a statement as of May 20th that they were expressing deep concern regarding the proposed health provisions in the reconciliation bill moving through the House of Representatives. And reading through their statement, I was kind of shocked that in one area they note of particular concern, this reconciliation package would severely limit access for lawfully present immigrants, stripping premium tax credits and cost-sharing support from nearly 112,000 Californians. The language goes far beyond excluding deferred action for childhood arrival recipients from accessing marketplace coverage, targeting nearly 40 qualifying lawfully present groups that have traditionally been eligible, including those with work and student visas, refugees, asylees, and victims of trafficking. Lawfully present immigrants losing access to this financial support essentially bars them from health insurance due to higher costs. And they are absolutely correct. Health insurance is expensive. One of the things Congress isn't addressing is the cost of health care. And the insurance rates, whether you like it or not, the bulk of the insurance rate is reimbursing the claims for the providers, the doctors, the imaging, emergency room services, hospital services, and prescription medications. And that all goes into making health insurance very, very expensive. And without these subsidies, most people can't afford the health insurance. And these people, I mean, I work with people on, visas, work visas, and they would just go without health insurance because they would not be able to afford it. Now, I have not looked at the language. It doesn't appear this is targeting green card holders, but people with other status that are lawfully present in the United States. The LPR, lawfully present permanent residents. And those are the people that are in our communities, they're our neighbors. And, some of them are working, some of them are creating music, some of them are going to school, they work gig jobs. And it's important to have health insurance. Covered California also notes that Congress may fail to extend the enhanced subsidies that were initiated in 2021. And they estimate that nearly 600,000 people of 7.3 million Americans forecasted to drop marketplace coverage, that was from the Congressional Budget Office, are covered California enrollees. That would be 30% of nearly 2 million enrollees in health insurance through Covered California. So the enhanced subsidies, and it's on a curve, but it really helps lower income individuals and families afford health insurance. And we saw health insurance premiums drop with the enhanced subsidies from maybe a couple $100s a month down to $100, or many people are paying zero if they have very, very low income. And if those enhanced subsidies go away, it's very hard for people to just add $100, $200, or $300 into their monthly budget. I mean, there's rent, there's food, and these people are working. And that's the other thing that kind of kills me, is that in order to be eligible for the Affordable Care Act and the health insurance subsidies, you must have taxable income. So that means whether you're a citizen or a lawfully permanent resident, or you have taxable income, you're paying taxes, you are paying rent, you're contributing to the community, you're buying local goods, you're actually producing something, as opposed to members of Congress who have the arrogance to dictate to low income, moderate income people how much they should pay for health insurance, because those folks in Congress, they have employer sponsored health insurance. So what do they care? They're running around in their suits and their ties, and they've got employer sponsored health insurance and they make a lot of money. But it's just really, really unfortunate. Other issues that Covered California notes in this budget reconciliation bill is increased red tape and bureaucracy, because people are going to have to jump through more hoops to prove that they are eligible for the subsidies. A shortened open enrollment period. Instead of going through the end of January, it would only be like 45 days, and that will squeeze people. And an increased tax burden on self-employed, low-income, and hourly gig and seasonal workers by forcing them to pay back more tax credits when their income changes. And that may have to do with some IRS repayment limitations on the excess advanced premium tax credits. I'm not sure. We have seen this xenophobia. We've seen the white supremacy being exhibited by the Republicans in Congress. Back in the 1880s, when there was just a big hate on the Chinese immigrants. And they were filling all kinds of jobs because there was actually kind of a shortage of labor at times in different parts of California. And but there was just people that just hated the Chinese because they looked differently, they spoke differently, they wore different clothing. And people would put signs in their windows of their shops, we don't hire Chinese labor, because there was a boycott against any shop owner that employed Chinese labor in laundry or making goods. But most people kind of looked past that, and a lot of employers like the railroads, they looked past that and they would still hire Chinese labor. But this is what it all reminds me of, this white supremacy movement of the late 19th century, and the xenophobia. I don't know what we can do about it, but at least you kind of know that it looks like the health insurance subsidies through the Affordable Care Act and Covered California are going to be stripped away for many people, reduced for a whole lot others, because Mike Johnson and the Republicans have their own employer-based health insurance, and they just really don't care about you and your budget. So you can leave comments if you want to. I may or may not answer them, but if I do, I'll do my best to provide up-to-date answers. Otherwise, for InsureMeKevin.com, I'm Kevin Knaus.